Hello again, this is Ray from Associates in Emergency Care. Today we're going to be talking about a medication, and the medication is calcium chloride. This is a medication that is classified as an electrolyte. The way that it works is it increases cardiac contractility, and it causes the ventricles to produce electrical impulses with a stronger ability. It is useful in reversing any dysrhythmias that are due to hyperkalemia. And this is something that we see a lot with dialysis patients. When do we use them? Indications: hyperkalemia, once again, hypocalcemia. We want to treat the adverse effects caused by calcium channel blocker overdose. We can use it in hypermagnesemia. We can use it in crush syndrome with a suspected hyperkalemia, which is one of the big problems with that pathology. And in times when we don't use it, in cardiac arrest, there is no contraindications unless we suspect those items that we mentioned specifically, but we would have to be knowing that beforehand. And any patients that are currently taking digoxin, digitalis, with suspected calcium channel blocker overdose, it wouldn't be a good thing to put those together. Some things that you should look out for: adverse effects. It has a propensity to produce bradycardia if we push it too fast. So once again, this is a low and slow administration. We may cause syncope, cardiac arrest, other arrhythmias, including bradycardia. We might cause hypotension, and if it's, especially if it's administered too quickly on any of those. The dosing that we're going to use. So the dosing comes in two varieties. So I am going over calcium chloride, but I do want to give you the dosing for calcium gluconate as well. For calcium chloride, the dosing for an adult is 1 gram. And we are going to push that again. I'm going to emphasize on the very slow IV push, or diluted, I should say. The pediatric dosing for that is 20 milligrams per kilogram with the same precautions. And then if you were going to administer calcium gluconate, then the adult dosing goes up to 3 milligrams and the pediatric dosing goes to 20 milligrams per kilogram with all the same precautions, no matter what type of calcium you're giving. Some things that you want to be mindful of, we describe those as pearls of wisdom. You want to be careful again with any of the digitalis or digoxin patients. We don't want to increase an irritable ventricle at any rate, and you especially want to ensure drawing up the medication in its own line whenever possible, or really flush the line that you're using, especially in the presence of sodium bicarbonate. When you mix the two together, they have a tendency to precipitate, causing a chalk inside of the line. And sometimes the calcium salts have been known to produce cerebral and coronary arterial spasms. So also things that we want to be mindful of, and sometimes those are brought about by the rapid administration. Once again, calcium chloride with calcium gluconate dosing introduced to you there. But as always with all your medications, be sure to check for any additional contraindications, allergies, or anything that would prevent you from administering the med. Thank you. We'll see you again.